This video will review the muscles of the forearm supplied by the radial nerve. This nerve supplies the muscles in the posterior compartment of the forearm. Try and copy some of the movements shown in this video for a better understanding of the action of the muscles. Before we begin, it is important to note that I may refer to the common extensor origin. This is the lateral epicondyle of the humerus, and it is a common proximal attachment site for many of the muscles in the posterior compartment. Let's begin by looking at brachioradialis. It originates at the lateral supracondylar ridge of the humerus and inserts into the styloid process of the radius. It is supplied by the radial nerve within the forearm before it divides into the deep and superficial branches. These pre-division nerve roots are C5, C6, and C7. Brachioradialis flexes the elbow and does so most effectively in the semi-prone position, as shown here. Now let's look at the muscle anconeus. Anconeus originates at the common extensor origin and inserts into the olecranon of the ulna. It is supplied by the radial nerve with roots C7 and C8. T1 may also give innervation. Anconeus acts to extend and support the elbow in full extension. Let's move on to extensor carpi ulnaris. This muscle originates at the common extensor origin and inserts into the base of the fifth metacarpal. It is supplied by the posterior interosseous nerve, a branch of the radial nerve, with roots C7 and C8. The muscle acts to extend the wrist and adduct at the wrist. It is important to remember that this hand is in prone position, so if it's looking a bit strange to you, take time and reorientate yourself. Let's move on to the supinator muscle. The supinator originates from the crest of the ulna and the lateral epicondyle of the humerus. It wraps around the radius and attaches to the radial collateral and annular ligaments. Finally inserts into the shaft of the lateral radius. It is supplied by the deep and posterior interosseous branches of the radial nerve with root values of C7 and C8. As the name suggests, this muscle acts to supinate the forearm. It is able to do so because it inserts into the radius and therefore can rotate this bone. All supinating muscles attach to the radius. Let's look at extensor digiti minimi. This muscle originates at the common extensor origin and inserts into the dorsal digital expansion of the little finger. It is supplied by the posterior interosseous branch of the radial nerve, C7 and C8. It acts to extend the metacarpal phalangeal, proximal interphalangeal, and distal interphalangeal joints of the little finger. Now let's look at extensor digitorum. Extensor digitorum originates from the common extensor origin and inserts into the dorsal digital expansion of the index, middle, ring, and little fingers. It is supplied by the posterior interosseous branch of the radial nerve, C7 and C8. It acts to extend the metacarpal phalangeal joints and extend the proximal and distal interphalangeal joints of these fingers. Now let's look at extensor pollicis longus. This muscle originates from the shaft of the ulna, attaches to the interosseous membrane and inserts into the base of the distal phalanx of the thumb. It is supplied by the posterior interosseous branch of the radial nerve, C7 and C8. It extends the carpometacarpal, metacarpal phalangeal, and interphalangeal joints of the thumb. It also assists in wrist extension. Now let's look at extensor pollicis brevis. This muscle originates from the radius, attaches to the interosseous membrane, and inserts into the base of the proximal phalanx of the thumb. It is supplied by the posterior interosseous branch of the radial nerve, C7 and C8. This muscle can assist in wrist extension, but its primary function is to extend the carpometacarpal and metacarpal phalangeal joint of the thumb. Note that it does not extend the interphalangeal joint of the thumb. This is because it has more proximal attachment than extensor pollicis longus, and therefore does not cross the interphalangeal joint. Now let's look at abductor pollicis longus. Abductor pollicis longus originates from the radius, attaches to the interosseous membrane, ulna, and finally inserts into the base of the first metacarpal. It is supplied by the posterior interosseous branch of the radial nerve, C7 and C8. This muscle can assist in wrist extension, but its primary function is to abduct the thumb. Let's have a look at extensor indicis. This muscle originates from the posterior surface of the ulna, attaches to the interosseous membrane, and then inserts into the dorsal digital expansion of the index finger. It is supplied by the posterior interosseous branch of the radial nerve, C7 and C8. This muscle can assist in wrist extension. It primarily acts to extend the metacarpophalangeal, proximal interphalangeal, and distal interphalangeal joints of the index finger. Now let's look at extensor carpi radialis brevis. This muscle originates from the common extensor origin and inserts into the base of the third metacarpal. It is supplied by the posterior interosseous branch of the radial nerve, C7 and C8. Extensor carpi radialis longus originates from the supraepicondylar ridge of the humerus and inserts into the base of the second metacarpal. It is supplied by the radial nerve pre-division, C6 and C7. Extensor carpi radialis brevis and longus act to extend and abduct the wrist.